Hello, I'm Zachary Reed. I'm a social worker and an adult peer support specialist here at One Day at a Time Rehabilitation. What is your name and what do you like to be called?
Well, I go by Sam. My name's Samantha.
Okay. How old are you?
25.
Okay. All right, awesome. I'll just let you know the purpose of this interview and cover some formalities and then we'll get into it, okay?
Okay.
The purpose of this is just to assess the overall severity of your substance abuse disorder and to learn a little bit about your background and a little bit about you so that we have the proper foundation moving forward for your stay here. Before we get started, I'll cover the policies and ethics. Everything that we say and talk about will be confidential, even if someone calls and tries to get information about you, whether it be a family member or a friend. We will not release any of that. We won't tell them anything. Anything that you say in here will not be repeated. The only thing that I'm required to report is if you're a harm to yourself or others. So that covers that. How do you feel? Do you understand everything? You understand our purpose? And how do you feel about moving forward?
Yeah, that's good.
Okay, good. All right. Well, let's see. When did you first start using?
Well, I first, tried anything when I was like probably 14 or 15, but I wasn't using back then like I am now.
Okay. What did you use the first time? Do you recall?
Well, the first thing I ever did was just smoke weed. Well, I drank alcohol probably before that too, actually.
Okay. All right. What do you use now?
Well, the main thing I'm using now is pain pills.
Okay.
But sometimes I still use other stuff, like if I can't find any, or just sometimes if other stuff is around.
Okay, so mainly opiates.
Yeah.
Okay. How often do you use?
Every day, for sure. I mean, I guess if I couldn't get anything, there might be one day where I didn't use, but definitely every day that I can.
Every day that you can, and is that primarily opiates every day, or do you use just whatever you can get in a day?
Well, it's definitely mostly opiates in a day.
Okay.
Yeah, I don't use other stuff like every single day. Really.
Okay. How much do you think you use it in a normal day?
Well, it's
just an estimate. It doesn't have to be exact.
Yeah. Well, probably like 10 or 15, pills a day.
Okay.
The most I can get.
Okay, so 10 to 15. Okay. And what's your method of use?
I just take them or snort them. I've never injected.
Take them, you mean just swallow them?
Yeah.
Do you chew them?
Sometimes. It kind of depends on how many I'm taking at once.
Chew them, okay. And snort, you said that you don't use a needle or anything.
No,
Have you ever used a needle?
Well, I have like twice, but I don't really like to. I haven't done it in a long time.
Okay. All right, well, do you have a history of mental health or anything like that? Disorders, depression, anxiety?
Well, I think that I have some depression and anxiety, but I mean, I've never been to the doctor because of that.
You've never been on any kind of medication?
No.
Okay. Let's talk about your family a little bit. Is there a history of mental illness in your family?
I don't. Maybe some depression, like from my mom or something, but I don't.
Treated?
No. I think she maybe went to the doctor and was on some medicine at one time, but she's never been severe, I guess, or anything.
Okay. Does your family know about your drug use?
Yeah, they do now.
How long have they known?
I'd say they kind of started knowing around 3 years ago, but they just didn't know the full extent of it.
Okay. And how do they feel about it?
Well, want me to stop, that's for sure. I mean, they definitely want me to be here. It's caused a lot of like fighting between us.
What about anyone in your family? Do they use or have they used in the past?
Yeah, there's not my parents, but there's other people in my family that I think have had some drug problems in the past, or maybe even now, but I don't like hang out with them or anything really.
Okay. Well, tell me why you're here now. You said you're 25 years old.
Yeah.
Have you been to treatment before?
No.
Anything outpatient counseling, any form of therapy,
No.
Celebrate Recovery, anything like that?
I mean, I've been to Celebrate Recovery like once or, well, maybe more than once, like maybe 3 or 4 times. Not really, not a lot, not regularly. It was, kind of uncomfortable. But I went because some people had asked me to, so I went a few times. But I haven't ever been to any other kind of treatment.
Okay. So let's talk more about why you're here now.
Oh, yeah. Well, I mean, I want to be here. I do want to make a change. I am tired of living like this. But, my parents also really wanted me to come now. And it's kind of getting to the point where I don't have, like, a lot of resources anymore. Like, I can't really keep a job anymore because if I'm sick, then I won't go into work. But it's kind of getting to the point where I can't really, like, keep up. I can't really pay for what I'm using anymore. Even if I do go to work, it's just getting, like, more and more expensive, and I'm just depressed because I want to stop, and I don't really have a lot of, like, friends anymore, like friends from high school. They've all moved on and started, like, doing things, or they have kids or whatever, or they're married, and
Okay.
I just don't really, like, have any direction in life. I went to school, college, but I didn't finish it because I just couldn't keep up anymore after a while, using and stuff. I'd like to go back to school probably, and I just want to be able to, like, live on my own and not be using stuff every day.
So you seem to feel like you're kind of at the end of the road.
Yeah, I mean, there's nowhere else for me to go, really. I mean, it's just going to get worse, I think. If I keep going this way, it's not going to get any better.
So you feel like you have to change now because you're running out of options?
Yeah, for sure.
Okay.
I mean, I haven't ever overdosed. I've known a few people that have at this point. I'm scared of that. I've been offered heroin a lot more lately than I...
Have you accepted that offer?
No, I haven't used any yet.
Never in the past?
No.
Okay.
But it keeps coming up, and I'm afraid that I'm going to go there soon, and I don't know what would happen if I did go there.
Okay. All right, well, on a scale of 1 to 10, what would you rate your substance use? 1 being not a problem, 10 being the worst as it can be.
Well, I definitely know people who are worse than me, so maybe like a 6 or a 7.
Okay. All right. Well, so if you decide to come now, it sounds like you're ready for a change, that you're out of options, and that you just want to be able to be successful in life and move forward from here. Would you agree with that?
Yeah, definitely. I want to be able to move forward. I hope I can do this right and not have to do it again, not be like some people that I know that have been to rehab a lot. I mean, I'm not judging them for going to rehab a lot. Everybody
Sure, yeah.
has their own path, but
Yeah.
want to be able to do it right this time and move on. I don't want to keep having to do this.
Okay. Okay. All right. So, if you were given the option, because this is a 28-day program, if you stay the 28 days and you're given the option to stay long term, do you think that that is something you're open to, or do you think that that is something you're not open to? And just be honest. Things change over the course of 28 days. I just want to know kind of where you're at right now in your mind, how you're feeling about that now. I know that, I'm in recovery myself. I'm a peer support specialist as well. I've been to long-term residential treatment before, so I kind of understand a little bit about the nerves that you're probably having right now and how you feel and what you're going through. And I know that 28 days seemed daunting when I went to rehab, and I was certain that I wouldn't stay longer than that. I did, however, end up staying for 8 months and really turned my life around. And you had mentioned that you wanted to go back to college, and that's what I done. I stayed long term, and then they helped pave the way for me to get back up on my feet and start working and enroll in college. So do you think that that's something you're interested in at this point, or no, or do you just want to play it by ear?
Yeah, I mean, that's a pretty big commitment. I don't really have a lot going on, but I don't really want to say that I would stay longer than that. So I guess that we will have to see how it goes.
Yeah. Well, you don't have to give me a commitment now or anything. I'm not the guy for that job. Somebody else will talk to you about that. I'm just trying to get into your headspace and see how you feel about that. Do you feel nervous about your stay here since this is your first time in a residential program?
Well, yeah, I mean, I'm nervous. I'm scared of being sick, for one. That's the biggest thing. And then just scared of being around these people that I don't know and just, I don't know, having to be told what to do. I'm afraid it might be like, I don't know, being in jail or something like that, or just in elementary school or something. Like, do I have to ask permission to go to the bathroom? I don't know how anything works.
Sure, yeah. So kind of feeling nervous about being institutionalized and dealing with maybe structured living that you're not used to dealing with.
Yeah, and two, I just don't I don't know if other people here are really going to be like me or if they have problems that are a lot worse than me. So, I don't know, if I get along with the other people or just how that's going to be.
Yeah. Yeah. So maybe feeling a little concerned about meeting other people, new people, and where you're going to fit into the mix of things.
Yeah, well, I mean, if you use drugs, then it's hard to trust people too, so.
It is.
It's not I don't really look forward to trying to trust these people that I don't know, but.
Well, things like that take time.
Yeah, probably longer than 28 days.
So, what are your plans from here? What do you see yourself getting out of this program?
Well, I hope I just learn how to stop using, whatever that means. I mean, other people do it, so it's why can't I do it? Because I definitely tried on my own, and it didn't work, so there must be something that I don't, understand or don't get. Why can't I stop using?
Okay. You mentioned wanting to stop, and you mentioned earlier that you were nervous about being sick. Have you ever detoxed before?
In a facility or just at home?
Both.
Well, no, I've never detoxed in a facility. At home, I've tried. I wouldn't say that I actually ever fully, made it or detoxed. I've just, been really, really sick, but I kind of gave up before I ever got over the sickness.
Okay, yeah. Well, you know as well as I do that opiate withdrawal is a massive thing to take, and it is not comfortable, but it is possible. I'm living proof of that, and there's a lot of people in here that have been sitting where you're sitting. So if you said that you've made it at home a little bit. How long do you think you've detoxed? Have you ever made it a week without using, since you have been addicted to what you would consider addicted? Have you detoxed for a full week?
I don't think so. Maybe close to it, like 5 or 6 days. I don't think I've ever made it a full week. I mean,
Okay.
especially without using anything at all, because sometimes, I mean, I've tried to detox, but then maybe I wouldn't use an opiate right away, but I would use something else to help me not feel so bad.
Okay. Just for some clarification here, what would you use to make yourself to help you with your detox? I guess you would say.
Well, like if I can get any kind of like nerve medicine, like Valium or Xanax. But I mean, sometimes I've even used, like, I did use meth just a few times, which I really, regret. I'm not proud of that, but I heard some people say that it helped. So, like that kind of stuff. And of course, I have smoked weed too to try to help.
Okay. What about Suboxones? Have you ever taken Suboxones or any form of that?
I have used Suboxone, but it's pretty expensive. I mean, even compared to just like pain pills, it's expensive. And
Was it prescribed to you?
no,
Okay. So, but you have used that to detox?
yeah, I've used it, but sometimes I feel like it makes me sick too, which maybe it was just too much or something.
Okay. Well, we do offer Suboxone here for detox. It's recommended 3 to 7 days here. Is that something that you'd be interested in to help you through your detox period, or do you want to do it with a more holistic approach?
I probably want to use Suboxone
Okay.
if it's available. I mean, it'd probably make it easier.
Okay. Well, I think I've got enough information here, and I'll be seeing you again tomorrow, and then we'll see each other 2 times a week for 3 weeks, and then we'll go from there. So it's been a pleasure getting to know you, and best of luck, and I hope that it all works out and you find recovery, because it is possible, and I think you can do it.
Okay, well, thank you.
Mm-hmm.